Why does stroke lead to blood pressure problems? Imagine your brain as the control center for your body's automatic functions, including blood pressure. When a stroke happens, especially an ischemic stroke where blood flow is blocked, it can throw this control system into chaos. The brain regions responsible for regulating blood pressure get damaged or disrupted, which can cause the body to react in unexpected ways. One common response is a sudden spike in blood pressure, known as an acute hypertensive response. This usually happens within hours of the stroke and can last 4 days. This increase in blood pressure is not random. It's a complex reaction involving the nervous system, particularly the part called the autonomic nervous system, which controls involuntary functions. When stroke damage occurs, it often impairs the areas of the brain that keep this system balanced. As a result, there is often an overactivation of the sympathetic nervous system, which is responsible for the fight or flight response. This causes blood vessels to tighten and the heart to beat more forcefully, raising blood pressure. Another key factor is the brain's effort to keep blood flowing to the affected areas. Normally, the brain can adjust blood vessel diameter to maintain steady blood flow despite changes in blood pressure. This process is called cerebral autoregulation. But during a stroke, this mechanism can become impaired. The body then compensates by raising systemic blood pressure to push blood through narrowed or damaged vessels, ensuring that oxygen and nutrients reach the brain tissue. Other factors can also push blood pressure higher after a stroke. These include stress from hospitalization, pain, infections, urinary retention, or swelling in the brain called cerebral edema. If someone already has high blood pressure or diabetes before the stroke, these conditions can make blood pressure more difficult to control afterward. In essence, stroke causes blood pressure problems because it interferes with the brain's ability to regulate cardiovascular functions. The body responds by increasing blood pressure to protect the brain's blood supply, but this can also make treatment more complicated. Managing blood pressure carefully during and after a stroke is vital. Too high can risk bleeding or further damage, while too low might reduce blood flow to the brain. That's why healthcare teams closely monitor and tailor treatment to each individual, aiming to keep blood pressure within a safe range to support recovery and prevent additional complications. Always consult healthcare professionals for personalized advice and management strategies.